Well, thank you very much, and good afternoon, everyone. And before I begin today with our COVID-19 update, I'd like to take a moment to reflect on a tragedy that occurred in our province 2 years ago today. 16 lives were lost, 13 additional individuals were injured. In our communities, our province, our nation, we rallied around those whose lives were lost and their families, and those whose lives were changed forever. And today we remember our Broncos, and our thoughts are with those who continue on their legacy each and every day. Today, the Chief Medical Health Officer has reported 4 new cases and 14 additional recoveries. This means that for the first time since the arrival of COVID-19 to Saskatchewan, the number of new recoveries has exceeded the number of new confirmed cases. Starting today, we are now reporting active cases. Active cases are the total number of confirmed cases minus the number of confirmed recoveries and the number of fatalities. So active cases are down by 10 today, from 179 yesterday, now 169 active cases today. Now that's just one day. So it's far too early for us to say whether this is any sort of trend in Saskatchewan, but it is good news, and it shows that what we are doing is working. Together we are reducing the spread, we are flattening the curve. So once again, I say to all of the people in Saskatchewan, thank you for your efforts. You are making a difference, and you are saving lives. But we need to continue. We need to keep going. To that end, our healthcare system will be planning and preparing to ensure that Saskatchewan is equipped to deal with a potential surge in COVID-19 related cases should they occur. Last week, I committed that the Saskatchewan Health Authority would provide an update on Saskatchewan's modeling projections and the capacity that our health system is building to deal with any potential surge in COVID-19 cases. And I can confirm that the Saskatchewan Health Authority will be providing an in-depth briefing this Wednesday, April the 8th. This briefing will include a number of modeling scenarios of the impact of COVID-19 in Saskatchewan. And these are scenarios. And it will include an overview of the SHA's surge capacity plan. The Saskatchewan Health Authority is providing this update because we feel it is important that the public have access to the latest and most accurate information available. And to ensure that the public is consistently has the latest information available going forward, the Saskatchewan Health Authority will provide a provincial update each and every Tuesday. So thank you for joining us here today. Dr. Shahab will have some opening comments, and we'd be happy to take any questions.
Thank you, Premier. So I'll just go over some of the numbers in some detail and some of key observations for today. So over the weekend, as we know, we reported a total of 29 new cases, 11 on Saturday, 18 on Sunday, but 4 on Monday. So again, our numbers keep going up and down, but seem to be fairly low, and that's good, and we need to keep it there. 81 individuals have recovered, that's 32%. And as the preview mentioned, we are also now reporting on active cases, which are currently at 169. Of our total cases, of our 253 total cases, 112 are travelers, and the rest are all either community contacts, have no known exposures, or under investigation. So again, changing epidemiology. Our cases are throughout the health region, but testing rates and cases are higher in Saskatoon area and the north, and that is primarily because of in the north due to exposure to a mass event, and in the Saskatoon area it's a combination of more people who had traveled and more people who are either contacts of a mass event or other factors. So there was a question last time about the variation. So as far as we can tell, it's due to a combination of mass events in Saskatoon and the north, and more people returning from travel in the Saskatoon area. Couple of things we have been obviously, and as we do contact tracing, there's a detailed interview of cases and contacts, and a couple of things that we are seeing that I just wanted to talk a bit about is that we really have to, most of us who are not in essential services are staying home, and that's really good. But we are seeing, obviously, transmission in essential workplaces, and that actually validates why anyone who doesn't need to be at work should be at home. And so people who work in essential services, healthcare, industrial settings, grocery stores, they really need to be supported to minimize transmission among themselves and from members of the public were they to come in contact. And this really means to maintain good social distancing even in the workplace. Sometimes people, when they go to work, it's easy to fall back into your old habits, maybe sit down closer together for a meal, or when you're using a washroom, not being that diligent in terms of hand hygiene and not touching your face, eyes, and nose when you're opening and closing doors. So I think that's something that all of us have to remember, those for us who are still at work. And of course, actively monitor for symptoms, isolate immediately, and contact your manager for further advice as well as Healthline. The other thing we have received, we've seen in some of our recent cases that many of them actually are individuals within the household who went shopping. So it's really important that we are very thoughtful about who goes shopping and how frequently. We've heard that many grocery stores are doing a lot of work to minimize crowding and maintain social distancing, and we need to really support them to do that and go at a time that's less busy and follow instructions. And if possible, only one person from a household should go shopping for essentials, and if possible, no more than once a week, and make a list ahead of time and go in an efficient manner and get what you want and come back. We had reports of groups kind of browsing, and this is not the time to do that kind of activity. It really is to maintain that social distancing. And finally, there's a lot of discussion on mask use over the weekend. So again, I'll repeat what I said on Friday, that the primary thing that all of us have to do is stay home as much as we can. If you go out for a solitary walk, maintain that physical distance. And in those circumstances, as long as you're not going out while you're symptomatic, whether you use a mask or not really does not make a key difference. In settings where you may be going grocery shopping, again, all those other things, physical distancing, not touching your eyes, nose, and mouth, do apply. Obviously, if you were to choose to wear a cloth mask, the benefit of that potentially could be that if you cough or sneeze, and you don't cough or sneeze in your elbow but cough into your mask, you can prevent droplet transmission to other surfaces. But having said that, we all need to practice good hand hygiene and not touch our eyes, nose, and mouth in any case. So there may be a limited value of mask use, and there's obviously lots of ideas out there about how to make a mask. But we have to remember that we're not talking about medical grade masks that are reserved for people who are working in healthcare. And we have lots of benefits in Saskatchewan that we need to capitalize on. It is easy to maintain physical distance but remain socially connected in Saskatchewan, and that has to be our key pillar as we try to keep the curve as flat as we can. Thank you.
Thank you, Dr. Shahab. We now have about 25 minutes for questions. Operator?
We have Guy Quinville with CBC.
Yeah, nearly half of our, this is for Dr. Shahab, nearly half of our cases in total are under the age of 45. And also this past weekend, we saw our youngest demographic of people aged 19 and under see its biggest increase in cases yet. What do those two things tell you, Dr. Shahab?
So we will do some further analysis on age groups in terms of exposures, but we have to recognize that even though school is out and university is out, obviously people who work in essential services like healthcare, other industries may be of a younger age group. So that may be one factor in terms of potential cases. And also travelers come in all age groups, but that could explain some of the reason. But I think the other thing we need to remember is that susceptibility to getting exposed to COVID-19, it's uniform throughout age groups. Any age group, when exposed, will get infected. How that impacts us does vary by age groups. And again, I have to emphasize that any age group can develop significant severe symptoms, but the rate or the risk is very different. Children under 19, while if you can develop serious symptoms, and we've seen that happening in Canada as well, not in Saskatchewan, it's less likely. Adults 40 and under are a second group. and that are less likely to get severe symptoms, but then it progressively rises for every 10-year age group after that. So I think what it means is two things. One is that all of us need to practice physical distancing, good hand washing routines, but then all of us also need to protect the most vulnerable. That includes people who are older, who have underlying risk factors.
Follow-up?
Yeah, this is for Premier Mo. We're hearing that the system that the province announced last week for putting homeless people in hotels or single housing units is not actually operational yet. People who are symptomatic are being turned away to go back on the street or perhaps live with family and friends. So we're just wondering why that system isn't running yet and when it will be.
I'm not aware of that, but I am aware that the Minister of Social Services has been in contact directly with the shelter operators that we have partnerships with here in the province to ensure that if there are any gaps in the systems that we are utilizing in flowing people in and out of our shelters, if our shelters are full, flowing them into what's been adopted as our cold weather strategy, and how individuals that may have symptoms or be required to self-isolate, how we can ensure that that actually does occur with those individuals. So I'm not aware of the parameters of your question specifically. However, I am aware that the Minister of Social Services has been in direct contact with the shelter operators to ensure that if there are any gaps, they're being filled, and they're being filled very quickly.
Next question from the line, operator.
We have Callie Stefano with CTV.
Hey, I'm wondering about PPE. I've been hearing from the Saskatchewan Union of Nurses that for some nurses there's being rationing for things like masks, disinfectant wipes, and I'm wondering why that's going on in the province right now. And, do you think this is the best practice to ration PPE for healthcare workers?
We can go to the line for the Saskatchewan Health Authority.
Or Scott Livingstone.
So this is Scott Livingstone. I can tell you that there's been no direction across the Saskatchewan Health Authority to ration PPE supplies. We are working on PPE supplies and controlling them centrally to ensure that they are available where staff need them when they need them. We are aware that there was not an incident, but there is in Regina, the Regina General Hospital emergency, there was a local manager that was working on a case of supplying masks, 2 per shift, I think, to the staff on the floor. That was not direction provided centrally. As you know, like every other jurisdiction in the country, PPE is a struggle to maintain, but as I've said before, the Saskatchewan Health Authority is not short of any PPE at this time. It is always a concern as we move farther into the COVID pandemic and ensure that our supply lines open up and we're seeing regular orders coming in on a regular basis, which is not the case here in Saskatchewan or anywhere else in the country. But there has been no direction across the SHA to ration, but we have locked down supplies to ensure that we're using them appropriately, and that might be what you're hearing about.
So when you say lockdown supplies, like what I'm hearing about is that at a home care in Saskatchewan, healthcare workers are given a Ziploc bag with 2 disinfecting wipes in there, and they are told those are the only wipes you can use per shift. Is that the type of, getting a handle on supplies you're talking about?
No, that's not at all what I'm talking about. I'm not aware of that situation, but if you can give me specifics of the location, we'd be happy to follow up. What I'm talking about is that we're trying to what we've done is created a system of provincial allocation and provincial vision on our supplies so that we know what supplies we have at any given time. As we put the organization together over the last couple of years, it also means we put multiple supply chains together, so having that visibility is even more critically important today than it is on a regular day in our facilities. So no, that's not what I mean by the baggy supplies. What I do mean is we're looking at how we ensure that we're keeping the supplies safe, ensuring that they're used appropriately, but we're not rationing, as I said before.
And we'll go to our next question from the line, operator.
We have Ashley Martin with the Leader Post.
Hi, I think both of my questions will be directed to the SHA. The first question is, what direction are paramedics and patients being given with regards to refusal to wear a mask? Are they being ordered to wear masks, and what if they refuse?
So it's Dr. Susan Shaw with the Health Authority. I'm not aware of any situations where we've had either paramedics or patients refuse. We do have guidelines and requirements for the safe use of personal protective equipment. Excuse me, that's done after doing a risk assessment and an evaluation of the situation, and if indicated, the expectation is that the staff member does wear a mask. And again, I'm not aware of any situations where a patient has not agreed to good practice.
Do you have a follow-up, Ashley?
Sorry, yeah, my second question is about criteria surrounding visitors in SHA facilities. What direction, if any, are specific physicians being given to define what are compassionate reasons? Because on your website it says it could include end-of-life care, family of patients prior to a major surgery, or visitors aiding in clinical care at the discretion of the patient's care provider. And I'm just wondering who defines what compassionate is, and what if that differs between one physician to the other, and that kind of thing.
So Susan Shaw again. We're certainly taking the visitor restrictions that were enacted or put into place on around March 16th, and we continue to work to achieve better clarity on what the current working definition is. This includes working with our patient family advisors to make sure that we're hearing from all people involved. We certainly understand the challenge of restrictions and that it does cause heartbreak and a separation that what I think is one of the most important times in our lives is when we're admitted to hospital in terms of wanting our family around, but we also understand and support the need to be limiting risk and exposure to the community by having our visitors or our families as present as much as we normally would. As you know, the Health Authority is built on the foundation of patient and family-centered care, and having a common understanding of what is meant by the directive is important so that we can be consistent.
We'll go to our next question on the line. Operator.
We have Roberta Bell with Global.
Hi, my question is for Dr. Shahab regarding mask wearing. I heard him speaking about wearing masks potentially while grocery shopping, as we're seeing, or shopping, I guess, as we're seeing cases related to that. Is the Saskatchewan government or the Saskatchewan Health Authority's official direction now encouraging people to wear masks like it is across Canada?
So this really discussion has been going on for the last 2-3 weeks, 2-3 days actually, and I think we need to be very careful that we should not confuse. First of all, mask use in healthcare is done under a very specific protocol, and there's training that's provided for mask use in the healthcare setting to all staff, and that training is essential to make sure that mask use is safe for the person wearing the mask, as well as safe for the patient who's receiving care. In the community setting, everything that we have been doing for the last several weeks, and you certainly shouldn't use mask used as an excuse to go closer than 6 feet from another person. So having said all that, if people want to look at what's on various websites about how to design and use a mask, that's fine, but it has to be done understanding how you can use it safely and properly, and it should not change any of the other essential practices that are so important and that have demonstrated to have an impact.
Do you have a follow-up, Roberta?
So is the Saskatchewan government then recommending non-medical mask use for people going out, or maybe recommending encouraging? Is that something that we can say at this point, or no?
Well, I think there seems to be a recommendation, a soft recommendation from the federal government, and some direction about how it may be used from the U.S. CDC. But I think we need to think through this, and I think it's not really, these masks are supposed to be purchased or designed or made at home. So I think it's for each individual and family to look at that, is this something they want to do, and can they do it in a safe manner?
We'll go to our next question on the line, operator.
We have Lisa Schick with CJME.
Hi. I'm wondering, the Premier earlier this morning, you talked a bit about maybe relaxing restrictions. You hoped in May when you were on Gormley. I'm not sure if this would be for you or this would be for Dr. Shahab, but would you say that we're at the start of the peak, or what can you tell us about where we might be in the curve?
Oh, I was, and there'll be some modeling that will come forward later this week that may help clarify where the curve is and maybe even help clarify with respect to where Saskatchewan is, not only on the curve, but in our efforts to flatten the curve. And so that modeling will be coming forward on Wednesday, and that would be a good question to look at on Wednesday when that is presented. With respect to my comments this morning on how we have winded up, if you will, the restrictions here in the province of Saskatchewan, and looking ahead to what hopefully would be a time when we could start to remove some of those restrictions, I think it would be imperative for us to move very slowly and very methodically, if you will, when we are presented with that opportunity to maybe remove a restriction and then wait a period of time and watch very intently as to what happens with our positive ID numbers. And then if they don't change, then you would look at potentially removing a further restriction. And what we have heard across the nation is in some of our conversations with respect to when other provinces are peaking, there is a thought that it is some are starting to find their way to their peak, maybe the end of April or into sometime in May. But in Saskatchewan's case, I'm uncertain when that will be. We really are going day by day as we see the numbers in, and you can see today that the efforts that have been made by the Saskatchewan government, the public health group led by Dr. Shahab, and most importantly, put into action by people right across the province, have been showing results. And for the foreseeable future, we need to continue to do exactly what we've been doing the last number of days and weeks. It's working.
Do you have a follow-up, Lisa?
Yeah, actually, just kind of a separate question for Mr. Livingstone there. You talked about the, I guess, maybe not rationing, but the directions on PPE for some places being local and not coming from the health authority. Does that mean that you're not stopping those things? Because, for example, if somebody is only allowed to use 1 or 2 masks in a day and they're going to multiple patients, wouldn't that be kind of a problem with contamination?
So what we're doing is actually what we're doing is providing provincial directions. So there has been a task force identified within our Emergency Operations Center that's taking a look at all the evidence across the globe, including Canada, for the appropriate use of all PPE so that we can provide better advice and direction to the staff that are looking at when they're caring for patients, and so that it's available for their use. So are we stopping it? I mean, those quote-unquote rationing, or the example that I used, is a single example that we're aware of, other than the one that was brought forward in the other question. If somebody in the ER in our GH needed other types of PPE because they're caring for a patient that required it, they would have access to whatever they needed. And the advice that we'll be providing to our staff and our physicians that work with us and throughout the COVID pandemic will clarify PPEs. But I just want to highlight that not only is it important for us to have the PPE, but it's also critically important for us to use it appropriately. And whether or not SHA ever faces a shortage with PPE is dependent on, one, proper use today. And as you know, we only have, I believe, 4 patients in hospital with COVID. So we're not experiencing anywhere near our peak number of cases on an inpatient basis. So we're not burning through our PPE as we will once things start gearing up. And the other thing I wanted to highlight is, again, the public's efforts to slow the rate of transmission, which are already in effect, and we believe we're seeing significant results because of that public adherence to those measures, are also reducing our need for PPE and saving those supplies for when we're really going to need them.
We'll take our next question from the line, operator.
We have Adam Hunter with CBC.
Hi, I'm wondering what our turnaround time is for testing. How many days does it take to get a test result back?
So unless SHO, my understanding is that it's 1 to 3 days, and it may be a bit longer in some cases because there's a priority for healthcare workers, long-term care facilities, inpatients, because testing may be required quickly for healthcare workers to continue working to make sure that there's no case or outbreak in long-term care facilities, and obviously for clinical decisions in inpatients. But it is from same day to 3 days. And I want to emphasize that people in the community who now, obviously there's broad testing happening at a high rate. So if you have if you're asymptomatic, you have to practice social distancing, stay home as much as you can. If you have mild symptoms of a cough, nothing else, stay home till the cough gets better. If you develop fever, chills, aches and pains, even if you haven't traveled, call Healthline. They will assess your symptoms and advise testing, but you have to isolate yourself at the first sign of symptoms. So it's not a matter of getting the test result back and then taking action. You have to isolate yourself in the home, away from other household members at the first sign of symptoms. And again, we do see secondary cases in households. We want to minimize those instances as much as possible as well. So I think I just want to clarify that no matter how long it takes to get the test results back, if you're out in the community, it is essential that you self-isolate yourself at home, away from other household members at the first sign of symptoms.
You have a follow-up, Adam?
Yeah, I'm wondering, for the Premier, today the leader of the NDP asked for the government to work on manufacturing cloth masks for the public, and I know in the past we talked about PPE manufacturing, maybe here at home, just in general, from different companies. Do you have an update on where you're at as far as maybe securing some local companies for making, gowns, masks, things of that nature? Is there any update on that?
We have had a number of individuals reach out, both in Saskatchewan and as well as at the Premier's table. We've been working on this effort from more of a national perspective, if you will, and so we're very thankful for the Saskatchewan businesses that have reached out with respect to visors, with respect to gowns, with respect to a number of PPE equipment, different kinds of personal protective equipment that we do need, and quite frankly, most of the world is looking for the very same items right now. We also have a national effort, if you will, when it comes to the N95 masks or an equivalent thereof, and that my understanding is that's been led by Ontario, and I give credit to Doug Ford for his leadership on this file. Premier Doug Ford has done an exemplary job bringing together some of the manufacturing power that they do have in Ontario, and my understanding is that they are testing some of that product with the intent of supplying, for the most part, Canada as we move forward into the next number of weeks, which may prove to be crucial weeks from a healthcare delivery perspective. We aren't looking currently at as a government of building cloth masks, if you will, and supplying to them to the public. In saying that, if people are comfortable, more comfortable wearing a mask, they should do so. They should wear a mask. They however, shouldn't be using a medical grade mask, if you will. Those masks should be reserved for the appropriate use in our medical facilities and for our medical professionals in delivering the care that they have. They also, although you maybe feel more comfortable wearing a mask when you are maybe out getting groceries or have to be in a public area, it should not replace the physical distancing that Dr. Shahab has spoken about, the 6 feet or 2 meters distance between people whenever possible. The fact that we need to continue to keep our hands clean, wash your hands and wash your hands again. So if people are comfortable, wearing a mask makes people feel more comfortable, they should do so, but they should not do so and then let up on the physical distancing that is also so very important. And I would say that with today's numbers and the last number of days numbers here in Saskatchewan, that it is working.
We have time for a couple more questions from the line. Operator, next question.
We have Allison Sandstrom with PA Now.
Hi, thanks for taking my question. I want to ask about on-site testing kits. I've spoken to some First Nations leaders in the north who would like to see on-site test kits so they can test more quickly. And I know that in Alberta they've ordered some rapid COVID-19 test kits. I was just wondering where we are in terms of getting on-site test capabilities in some northern or rural communities. Just where we are in terms of that.
So we can provide a more fulsome update on how different testing platforms are being assessed and licensed for quick use in Canada by Health Canada, and what the plan is for Saskatchewan to acquire some of those to distribute testing capacity, so we can provide a detailed update at a future date. But having said that, right now, I think we need to be very proud of our partners in the SHA and the provincial Roy Romanoff Provincial Laboratory, that they have really ramped up testing capacity to meet our updated testing guidance that really now tests widely throughout Saskatchewan and tests, for the most part, people who have not traveled and who are out in the community. So I think we are very happy with the expansion of testing volume, as well as the geographies, 30-plus sites in Saskatchewan where you can, after assessment by Healthline, get a test, or upon referral by a primary care provider. So I think we are at a very positive place now in terms of testing, but certainly as this evolves, other options are being considered, and we can provide updates as those options are implemented.
I would just add to that, Allison. This was a topic of conversation with Chief Cameron and myself late last week when we talked last with respect to the testing kits that have been made available in First Nations communities have been provided by the federal government, and there's a feeling that there hasn't been enough of these kits provided. And so we would just encourage all people in the province of Saskatchewan, whether you live in an Indigenous community or otherwise, that the 811 health line is open to you. You can be referred to a test. They will ensure they can advise you as to the closest area where that testing can occur. As we move forward, we need to continue with the number of tests and the ease of testing that we have, also, and that includes in rural and remote communities. But to date, and Dr. Shahab has mentioned this, the Roy Romanoff lab and the testing, about 40 testing facilities that we have across the province have done an exemplary job. I believe, last I checked, we were the second highest per capita number of tests in the nation, and we've shifted that away from travelers to contact tracing and testing those individuals that may be in that higher risk community transmission group. So we have a strong record over the course of the last number of weeks with respect to testing, but there's more for us to do in the weeks and months ahead.
Do you have a follow-up, Allison?
Yeah, I have a different question, and thank you for that answer. So rural municipalities are they've been asked by the SHA to request residents' up-to-date contact information. So residents would give this to the office, and then they would be able to be contacted in the event of a municipal emergency related to COVID-19, was the information that RMs said they got from the SHA. I was just wondering if you could flesh out what's behind this request and what a municipal emergency related to COVID-19 could be.
Scott Livingstone, do you have any information with respect to that question? You might still be on mute, Scott.
Sorry, I was on mute. Yeah. No, I don't have an answer to that question. But Susan, I don't know if Susan does either. I would suspect that part of getting updated contact information is both so that we can actually send notices out as things may change, as we'll find out on Wednesday this week with both the update on modeling and also the plan for dealing with the COVID surge. What you'll see is a stage approach. So the response to building capacity around the COVID surge will be dependent upon the type of cases that we see. So as you know, we're gearing up capacity now across the province in acute care facilities, purchasing equipment and getting new things in place. And we have quite a bit of capacity now, quite a lot of capacity now, especially when related to the small number of cases we have. But as we move through the COVID pandemic, our needs for changing or restructuring the system to support the COVID response will also change. So the importance of having that contact information, which is, I suspect why it was called, is so that we can notify communities and people in those communities what changes might be coming because of readjusting the system to respond to COVID. But we will follow up specifically about your question.
And we'll go to our last question from the line, operator.
We have Laura Woodward with CTV.
Hey there. I'm just wondering, Premier Scott Moe said this is the first time that recoveries have exceeded cases. Is this the first time in Canada as well?
I think British Columbia may have had a day a few days ago where their recoveries exceeded the positive IDs as well, and I would say that British Columbia would be what appears to be a number of days deeper into the curve, if you will, than Saskatchewan is. So this is positive news for our province. Dr. Shahab, anything to add to that?
Yeah, I think it's, the indicators are very positive in terms of that we are seeing people recovering at the other end, and of course are seeing a low daily rate of new cases. But I think we have to sustain the course for the time being. I think we're still fairly early on in our epidemic as part of the pandemic in Canada, and we really need to sustain the course for the next little while and continue doing all the good things that all of us are doing.
Do you have a follow-up, Laura?
Nope. Thank you very much.
That concludes all the time that we have for today. Thank you for joining us, everyone.